Welcome back to the second episode of our still yet to be named medical podcast. We are actively working on a name.
Any day now.
Any day now, we're gonna give you a name that just blows you out of the water. But literally, we have a list of like dozens of names, and we just haven't fallen in love with any of them yet. But we are actively working on that. And thank you to people who have submitted names. We really appreciate that, and they are on the list. So anyway, we've had a pretty significant delay since our intro episode, which, as you can see, from
I've developed
the
a
camera,
very large growth on my chest, which has prevented me from doing really anything, including recording a podcast. So
that's literally
There's
my
that.
first niece that you were referring to as a growth, and I will not allow that. And if social distancing wasn't a thing, I would come up to Maine and handle that. But anyway, man, no,
that's your uncle. That's your Uncle Emil talking.
I got you, baby girl. But how's it been, man? How's it been? Give us a quick update on how things are going.
Things are going great. She was born last Friday, so she's about 10 days old now. And she's healthy and she's beautiful, and we are just so in love with her. It really is amazing how the moment she came through the birth canal, we were just like so in love with her. And that's not like that. It's hard to imagine that experience until you actually have it. But it was, it was beautiful. It was incredible, and we're grateful. It's been very exhausting. So, everybody knows that having a newborn is going to be very tiring. I'm a pediatrician. Like, I tell parents that all of the time when they're leaving the hospital with their new babies. Like, this is going to be hard and you're going to be tired. But until you actually go through it yourself, like, you don't really have a sense of just how tired you are. Breastfeeding every 2 to 3 hours is exhausting, like, because that means you're not sleeping more than 3 hours in any given time. So, that includes through the night. So that's been hard, but we're doing it, and it's so worth it, and wouldn't change it or trade it for anything. So
Yeah, that's awesome. And I can tell from just our conversations over the last few days, your priorities have changed, and now things that are important to you in your life, other than your new daughter, are the leather handle on your stroller, the
that's right.
just size of the poop that she has, and other things which seem absolutely insane to me. But I can tell that, like,
It's
before,
the small
like,
things in life.
I guess before it was like
Or
podcasts,
do you have to?
other things. Now it's like poop, leather handle, like podcast. Do people care about?
By the
Do you
way,
even care that I sit here and wonder, about recording? And do people even care that I'm a new uncle? I think they do. You want me to talk about how
I care.
incredible it's been to not have been able to meet her because of social distancing? Maybe not, but it's it's a big.
Should
thing
we do
for
an
me
entire
too.
episode of the podcast in rhetorical questions? It's something
Probably.
to consider.
Do people want that? Yeah, they might. Who knows?
It's possible.
It is possible.
Look, I told Becky that I couldn't change the diaper because I needed social distancing from the diapers, and it didn't work.
Didn't work, huh? That flopped.
It didn't work.
Oh, that's awesome. But anyway, man, congratulations.
I'm working on my dad jokes too. Anyway,
Those are probably
sorry.
bad. Regardless, thanks, dude. Thanks.
They're not.
Congratulations. And thanks for making me an uncle for the first time. But congrats. Can't wait to meet her. I know once social distancing and everything goes by the wayside, that it'll be a great first meeting. So anyway, that's a great segue into, as we mentioned in the last episode, we want to start talking about coronavirus, and we want our first several episodes of this podcast to really tackle coronavirus. And that's a great segue into coronavirus and pregnancy, and kind of newborns and coronavirus, and what we've learned so far about that. We got lots of questions on social media about coronavirus and pregnancy and kind of everything related to that. So thank you for everybody who submitted questions, and that particularly seems to be a kind of a hot topic. So why don't we just jump into that right now? It seems like an appropriate segue. Dre, do you want to talk a little bit about kind of what we've learned about coronavirus and pregnancy and vertical transmission?
Yeah. So I think the first thing to say is, and we're going to just constantly sort of keep repeating this, that so much of this whole coronavirus thing is unknown because it's so new. Research has been slow. Not slow. I mean, research has actually been pretty fast, but it just takes time to collect data, to write articles, and to publish things. So It's an evolving story, and we're still just learning a lot about coronavirus in general. So when it comes to vertical transmission, by the way, being spread of the virus from the mom to the baby, either in the womb or immediately after birth, that seems to be pretty low risk, meaning a pretty low likelihood of that happening. There have not been tons of studies, as I just alluded to. I think the best study came out in JAMA Peds at the end of March. It was a study that came from Wuhan, China. Do you want me to talk about this study right now?
Sure.
This is a good time.
JAMA Peds is just a journal. As medical professionals, we read journals all the time to learn up-to-date information about what's going on. And JAMA Peds just happens to be one of the more prestigious pediatrics journals where information is coming out all the time.
Yeah, right, exactly. So in JAMA Pediatrics, they published an article that came from Wuhan, and in Wuhan, they had 33 pregnant moms who all got infected with the coronavirus and were sick with it. They took these 33 women, and they wanted to know what's going to happen to the newborns of these moms. And so what they did is after these moms gave birth, they swabbed all of the newborns. So they did the nasopharyngeal swab, down the nose, down the throat. And they also did an anal swab in all of the newborns. And that's testing for a PCR. And I don't think I'm going to go into PCR.
We'll tackle that in another
next episode.
Next episode.
Yeah, next episode, let's talk about like testing and stuff like that.
Yep.
But anyway, they did a PCR on all of these babies. And in 3 out of the 33 babies, they tested positive. So a little less than 10% of the babies born to the infected moms were positive. A couple of interesting things and sort of positive things to note is that all 3 of these babies did well. So meaning they all recovered. None of them died. 2 of the 3 babies were born at full term, and they actually had a pretty benign course. They had pneumonia, but were able to leave the neonatal ICU pretty quickly. And by day 6 of life, actually, both of them tested negative for the coronavirus, which means that they were able to clear it from their body. The 3rd infant was born prematurely, so born at 31 weeks, and was actually in the neonatal ICU for 11 days. They ultimately also did well, but they had a little bit more of a sort of rocky course in the NICU, which isn't uncommon for a 31-weeker. So whether or not, the 11 days and some of the things that happened were related just to the coronavirus or other things related to prematurity, remains to be seen. My sense is that it was a mix. And
well, that 3rd baby was also had sepsis from a bacteria as well. And was also very sick for a lot of other reasons. So definitely a mixed picture there. Right.
But the take-home message is that less than 10% of babies born to coronavirus positive moms in this study were positive. So that's not a large percent. Another way of saying that is 90 or 91% of babies will be negative.
Right. And this is just in one study. So, and that was a kind of a smaller group, only 33 patients, which is a fairly small number. So as Grace mentioned earlier, there's so much research that still needs to be done. As medical professionals right now, all we can do is basically take the data that we have so far and try to consolidate it and learn from it and then apply that to our patients as best as we can. But with coronavirus being so new, there's a lack of information, although that's getting better as we speak. There are literally hundreds and hundreds of research papers that are happening now and research trials that are happening now. So we're learning more and more every day. But the point is that from what we've seen so far, it seems like there's a very, very low likelihood of baby getting coronavirus from mom. And in the cases where they do get coronavirus from mom, the babies seem to be doing very, very well. Some of the reasons for that are, one, we've seen that coronavirus in patients, there's a very low amount of the actual virus in the blood. So the way that baby would get the virus from mom while baby is still in the womb is directly from mom's blood. And so we know that when you test someone with coronavirus, if you test their blood, they have a very, very low amount, if at all, virus in the actual blood. And so for that reason, it's a low likelihood that that blood, if it is infected, could even get to baby and infect baby, especially when there's the placenta, which is basically a phenomenal, brilliant filter of bacteria and viruses and ugly stuff to baby. So the virus, as we're finding out, is mostly just living.
I got one. How do you know the bacteria and viruses are ugly? She liked that.
No, she didn't.
She liked that. It's a dad joke.
No, she's literally
joke.
crying. She's
It's
literally
a
crying.
dad
What's the
joke.
answer?
No, there's no answer. That was the joke. That
It wasn't
the
a joke. There was no punchline. You just asked a
Okay,
question.
it's okay. All
She's
right,
she's
anyway.
literally crying.
So-
I'm sorry. She's literally. I want everybody to see what just
okay.
happened. Like
It's okay.
everything
That's
was
your uncle.
fine,
It's
and then
okay.
you said a terrible dad joke, which didn't even have a punchline, and I would argue wasn't even a joke, and she started crying. That was blasphemous. Regardless, where was I? So basically,
So
transmission
yeah.
is low, as we've seen so far, and the reasons for that are many. But Dreas, you want to dive into a little bit more about kind of what we're doing with pregnant moms, what recommendations are out right now regarding breastfeeding, things like that?
So if you go to the CDC's website, it talks about how to manage moms that are COVID-19 positive or considered to be positive. Basically, it says that if a mom is positive, you should strongly consider separating the mom and the baby after birth. And that's to decrease the risk of the baby becoming infected. That said, that isn't always going to be feasible based on the facility. It also may not be the mom's choice because that's super difficult to get separated from your newborn. And some moms may have a strong preference to not be separated. And I think there's room for that in the guideline. And I think it's a discussion to be had between mom and the healthcare team. So that's one thing. The second thing is about breastfeeding. So again, some other articles showed that there was not coronavirus found in breast milk. So to moms that were positive, their breast milk didn't have any virus in it. So we think it's safe to continue to give breast milk to the baby. The question is how do you do that? So again, the recommendation would be to consider pumping. So pump the breast milk and then have somebody who's healthy give the breast milk to the baby through a bottle. Or, again, up to the mom. If she's like, no, I'm going to breastfeed my baby, it's advised that mom wear a mask and practice good hand hygiene just so she doesn't, cough the virus onto the baby. So that's kind of where we stand with that, and I would sort of direct people to the CDC's website, which we can post.
Definitely. I think one thing we should say is that this podcast was not designed to give anybody any advice or make any formal recommendations. All we want to do is provide you with information that with that you can do whatever you want with. Dude, if you keep saying,
are you okay to keep going?
I'm
You keep
literally
going.
in an epic monologue right here.
You keep
All
talking.
right.
I'm gonna take her away. You keep doing your monologue. You're doing great. Proud of you.
Man. So anyway, we're just here to give it information for people to use with it what they want. We want to point people to sources that we trust. We know that there are so many different sources out there, and so we just want to give people the sources that are helpful for them, and that we trust. So in the next episode, we want to dive more into testing for coronavirus. We want to dive into some antibodies and some other treatment things that are under experimentation. We're gonna then transition into what does coronavirus look like? How is it infecting people? A lot of you from this episode may be wondering, okay, well, how are babies affected? How are children affected? Because that's not something we talk about all the time. So if any of that sounds interesting to you, please join us for the next episode where we will kind of dive into more stuff about coronavirus. But Dreas, thank you for sharing your experience so far, and I'm glad baby's getting to go have a little, lunch at this point.
Yeah, you did a great job. I'm proud of you, man. You did the whole podcast by yourself.
That just isn't true.
All right, we'll see you for the next episode of the podcast. We're out.
Peace.